Nearly 3 million adults in the United States have epilepsy, but the CDC says many of them don't know much about the brain disease and the seizures that it can cause. November is National Epilepsy Awareness Month, and today Jeremiah Jacobson has more on the spectrum disorder, including what to do when someone is having a seizure.
It's one of the most common neurological diseases. Epilepsy is a chronic brain disorder that leads to abnormal electrical discharges within the brain, causing recurring, unprovoked seizures.
It still carries quite a lot of mystery amongst the general public.
Dr. Dilip Nair with Cleveland Clinic says the severity of epilepsy varies from person to person, but it can affect anyone at any time of their life.
People who aren't really aware of the disease, it can look scary.
That's why Dr. Nair says it's important to know what to do when someone is having an epileptic seizure. There are 3 things to remember. First, keep the patient safe. Make sure they're not bumping into anything. Do not restrain them, and don't put any objects in their mouth. Next, turn them onto their side.
So that if there is vomit or saliva that's coming out, it comes out of the body rather than back into the lungs.
And stay with them. Time the seizure. If it lasts for more than 5 minutes, if they're injured, having difficulty breathing, or experiencing repeated seizures, Nair says to call 911 immediately.
Many people who have epilepsy have rescue medications that are prescribed, and if you're a caregiver or a family member and you have those medicines, you can use them as prescribed by your doctor.
Dr. Nair says there are dozens of anti-seizure medications and new therapies being studied, including gene therapy that can help some patients. There's also surgery for people who have drug-resistant epilepsy.